Friends, this is Dr. Ravi Kamapali. Want to bring it to your attention regarding role of body fat mass and surgical infection, and bring a case and discuss how body fat mass is affecting um, surgical outcomes. So basically, I'm located in Georgia, and my website is nobadbugs.com, and my Twitter handle is @woundphysician. And I am not having much of any conflicts except removing barriers to healing for infections, wounds, and obesity. So mostly when we look at body fat mass, we mostly look at body mass index as a risk of infection, and malnutrition with poor hygiene is noted to show some significant infection in developing countries, but also the U-shaped increased infection, wherein the in the U-shaped curve there is more infections when the nutrition is bad with malnutrition, or also overnutrition or energy toxicity. So several studies were done where children and adults who are underweight or obese are associated with increased infections. So I just wanted to bring to your attention a case of a 62-year-old female who had problems with hypertension and atrial fibrillation, and how we are trying to prevent her future infection by approaching this with appropriate weight loss with nutritional methodologies. She had hernia since 2008, and had after cesarean sections and hysterectomy, ended up having leg swelling and atrial fibrillation, and vitamin D deficiency. Her highest weight in 2019 was 333 pounds, with her improving to her weight of around 261 pounds when she presented, after she felt that she was stalled and she was doing Nutrisystem for weight loss. Ended up, we started therapeutic carbohydrate-rich with low carb lifestyle on 6/17/2021, and by 3/24/2022 she had lost 36.7 pounds of weight, of which 26.6 pounds was fat loss. So her goal is to come down to BMI of less than 30, and she did come down to improved BMI of 34, from 38.2 or so to 34. So that too, she did it without significant loss of basal metabolic rate. If you see, her weight had come down from 251.1 pounds to 224 pounds, and her body fat mass has come down from 131 pounds to 109 pounds. So basically, her percent body fat has come down from 52.2 to 48.8. Just this is her opinion on this whole approach.
Thank you for coming today.
I'm happy to be here.
So, then you have been one of my successful patients, and since I have come to LaGrange, I think you were one of my first patients who came here. What made you come to see us here?
My cardiologist recommended you because it seemed that losing some weight might take some of the strain off of my heart, since I have AFib.
Okay. How long have you had it?
It wasn't really diagnosed till about 2 years ago, but
Okay.
I've been having the symptoms since 2011.
Wow, since 2011. And then what was the reasoning behind this? You had some medical issues that made you refer apart from the heart?
We think that you mean what caused the AFib?
No, for the other reason why we wanted to.
Mhm.
You were doing some program before.
I was doing Nutrisystem, and I'd lost about, 70 pounds on that.
Before you came to me?
Before I came to you.
Uh-huh.
But I kind of reached a plateau, and I wasn't losing anymore. And it's probably because, and you can correct me on this, it was still including a lot of carbs in the diet. There were a lot of pasta dishes and bread and pizza and so forth.
Yeah.
And we've since determined I'm insulin resistant. I probably shouldn't have been eating those things.
Yeah. So basically, when you came to me on June 17, 2021, you were 261 pounds. So whatever the previous program was, Nutrisystem or whichever, it was it helped you lose, but then you got stuck. And the weight was 261 when you came to me. And essentially, uh, what did your surgeon tell you to do? What was the reason for your surgeon talking about hernia and all that?
Oh, the hernia is a separate problem, but I can't have surgery done to repair the hernia until I get my BMI lower.
Mhm.
And I believe I was told that it needed to be below 30.
Okay.
All right, but it's what, 34 now?
It's 34 now, but it was very high before. And then basically uh, you can see this one here. How we did the program is to help you come from 261 pounds down. And when we did this initial body composition testing, you were 251 pounds. And at that point, your excess fat was around 95.2 pounds. You lost around exactly 20 pounds of fat mass. So most of what people are suffering, people like you, is what I call a fat mass disease. And even burning 5 pounds of fat is kind of crazy, but you burn 20 off just by diet. And then you see this one here, your weight loss was 37 pounds. But of that, 20 pounds was fat. Yes, you did lose some muscle, but this muscle loss, this muscle and bone loss here, like the real muscle loss was 2 pounds, but it could be that the fat was inside your muscle and you're losing that. But the beauty of this whole thing is that you uh, you 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 are happy doing it. Are you happy doing this
It
thing?
was so much easier than I thought it would be. We're combining the intermittent fasting, so I try to keep my meals between 11 a.m. and 5 p.m. Um, and that and the ketogenic regime, where I have a list of foods that I can eat and foods that I should avoid. And once I discovered erythritol, I could finally have sugar in my coffee. It's not real sugar, but it's sugar derivative.
Yeah, but sometimes that for you it might be working, but for some people it will not. So it's like erythritol is like a sorbitol, and sometimes there are pathways in your body that convert the sugar, even regular glucose, even sorbitol can this thing can convert into something that causes trouble. So I'm talking about artificial sweeteners for some people can work, but some people will not work. So what I'm trying to get through and to my patients is, if it's working, that's fine, but as long as you do anything and track. So for you, you do something like you do food tracking. You are one of those diligent people who takes a beautiful picture. But so how do you like the feedback that you have been getting?
It's very helpful, and it helps me really visualize how much I'm consuming and to make sure that it's a healthy diet. So taking a picture of all the food that I eat.
And then you can go back and look at it and try to figure out if you kind of are in the process. So I keep talking to you about another thing about ketones. What did I tell you about ketones?
That's what I want to expel from my body in order to lose the fat.
Yeah.
And so I need to avoid anything that is carbohydrate, which would cause me to retain or convert to fat.
So
yes,
so
the diagram you showed.
The diagram I told you is like insulin is in the middle. So if you eat carbs or sugar, your insulin spikes up, and the carbs and sugar convert into fat. Whereas when you're eating fat, then the insulin goes down, and when the insulin goes down, the fat is expelled out as ketones. This is so simple, and the simple processes are sometimes hard to kind of do when people don't understand it. And people like you who understand it now, you feel that you're empowered. And then sometimes there are different techniques that I use, including trying to teach people how to do continuous glucose monitor and also ketone blood testing or ketone breath testing. So I bring those tools to my patients to help you execute this whole program. So you are being an empowered patient. I'm happy that you have been stuck with us, and hopefully that your surgeon now wants to do the surgery because of significant improvement in BMI. But I'm happy that you want to still, you think that you can have a better outcome when it goes down to at least that better number for
Yeah, I
BMI.
still want to lose 90 pounds.
Yeah.
I'm more than halfway, and I'm very encouraged. And
Yeah. But you have to understand that you have to not lose muscle.
Right.
Doing the muscle exercises, and then making sure that we track it, and it's very good. So since you're keeping the food log on your app that I gave you, and since you're working with this whole thing, I'll just have to see you only in 2 months, and we can do this test at that time, and then we can track it. So
okay.
at the end of the day, it is all about learning and tracking and making sure that you reevaluate it. Thank you for trusting me.
All right. It's been a pleasure.
Thank you very much. Thank you for coming.
So, like we see here, obesity and surgery, say in coronary artery bypass surgery, if BMI is more than 40, the complication risks are greater. And also, for in colorectal surgery, when the people are overweight or obese, and there is 50% higher odds of developing surgical site infection. And also, in this large study that was done in University of Cambridge, where they looked for BMI, which is really a broad way to measure the body mass, but it's a crude measurement. It's like taking the weight and telling, but in reality, we have to start looking at the fat mass of the person by doing advanced testings, including body composition analysis. Whereas here, they saw around 387,000 patients. This was the review of Dutch National Surveillance Network, where they found that increasing risk of surgical site infections was with BMI increased from normal to morbidly obese uh, among all the surgeries. But also, we have to understand that most of the complications happen because of all the major surgeries, even weight loss before gastric bypass, which low carb nutrition is being advocated now. And particularly in surgeries like joint replacement, the surgical uh, the recommendations for weight loss are being pushed because the BMI in joint replacements are noted to show more than 30 BMI, 1.7 times more complications, and more than 35, 2.2 times, more than 40 BMI, 3.7 times complications, and more than 50, almost 21 times complication. So the whole problem with this is the body fat mass. And if you have to understand this, it's a little one of the last slides that I have. At a broad stroke, we have to remember that any female, if the body fat percentage is more than 30% on a body composition analysis, and for a male, more than 25% is when we have to start looking at possibility of obesity playing role in clinical outcomes of any other non-communicable diseases. And particularly when you go through surgery, I guess the complications would also increase as the data is showing. Now, what we have to look at is overfatness, which is nothing but energy toxicity spectrum. It happens when the metabolic syndrome is happening in anybody with a disease process, but it is like we are storing the energy in the fat that is showing up as abdominal obesity, insulin resistance, elevated triglycerides, reduced HDL, and hypertension. And hyperinsulinemia metabolic syndrome spectrum is caused when we have to understand that we lose this flexibility of the metabolic process, where in a flexible metabolic state we have a lot of subcutaneous adipocytes. When the subcutaneous adipocytes are filled, then we become metabolically inflexible. And when you develop metabolic syndrome, that's when we have increased visceral fat, but excess fat in the blood, which mostly is triglycerides. And then other real complication is when that really shows up as a manifestation with diabetes, which is showing as excess triglycerides and excess glucose also. So the magic really is not in the pill. So medicinal treatment is not medical treatment. The medical treatment happens when we avoid mass medicine mindset and we come up with the proper n of one, that is each person is a person by themselves and they have to be taken into consideration. So there is no magic pill for proper human nutritional lifestyle. But the problem is also we have to realize that food addiction blinds us to the consequences, and sometimes the monkey mind takes over. So there's a lot of issues that we have to face in healthcare, but hopefully this is one of an example of a patient focused solution that we hope to deliver as we go through this whole journey of metabolic health improvement in removing barriers to healing. Please feel free to check out our social media sites and my website at nobadbugs.com, or you can check out hashtag removing barriers to healing to all the work that we are doing and trying to showcase positive cases and also complicated cases, depending upon the patients agreeing for us to do that. Thank you very much. Have a great day.